Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner from Portner Orthopedic, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and welcome to The Moving Body, like the man says. Hello, yes. We're here again this Saturday, as we are every Saturday live at this time from 7 to 8 on The Moving Body. We talk about the body parts that move, the parts of the body that allow us to move. And these body parts are subjected to all kinds of forces throughout our life. These forces generally make the parts stronger, believe it or not. And maybe we'll talk about that today. Wolff's Law, how forces make living tissues stronger as opposed to non-living tissue. The more forces you apply, gradually the weaker it becomes. With living body tissue, bones especially, but tendons, muscles, ligaments, all these materials that make up these structures become stronger the more you use them. So let's talk about that later. But for now, 521-8383. If you have any questions, the lines are open. You can call me now, 521-8383. If you have any problems or concerns or questions regarding the moving body parts, the arms, legs, neck, or back. Like the man said, my name is Dr. Bernie Portner. I'm an MD practicing in Honolulu and your host on the show. Every Saturday, The Moving Body. 521-8383. Neighbor Island listeners out there, if you can hear me all right, the toll-free number is 1-888-565-8383. That's toll-free for the Neighbor Island listeners, 1-888-565-8383. Get a pencil. I'll repeat those numbers as time allows. A quick little news flash. In the New York Times, reporting on an article that was published in the Journal of the American Medical Association this past week, indicated that they showed with a scientific study, and I'll talk about scientific studies, what the heck are they, that there's no good evidence that for severe sciatica, this is usually a disc-related problem, there's no real good evidence that having surgery results in any better outcome than not having surgery. And this shakes up the orthopedic world quite a bit because it was standard, and still is, I suppose. It was standard care that if you had a herniated disc pushing on a nerve causing pain down your leg, you needed surgery. And for a long time, I've known, and others have known, that that's not true, that if you could somehow get through the initial pain and disability for a few days or a few weeks using various medications, injections, therapies, in the end, you would recover. And your recovery would be no less complete, and in some ways preferred, to the recovery of those that underwent surgery. And whether you got surgery or not didn't seem to depend on how bad your condition was or what your condition was. It depended more on who you decided to go see for it. So in this country, if you have a severe backache or sciatica, pain down the back of your leg, that is, you would almost always see an orthopedic surgeon whose training led them to advise surgery because they knew that if someone had this condition and they did the surgery and they did it well and they were right about their diagnosis, the patient would feel better pretty soon. But if you compared those patients that saw a surgeon and had surgery with those who didn't have surgery with the same exact condition, 6 or 12 months later, they were the same. So that says a lot because surgery, while often successful, is sometimes catastrophic, whereas not having surgery is maybe postpones and delays your recovery a little bit, but is almost never catastrophic. So you have to weigh that. I'm not saying that surgery is never the thing to do, but this new study really casts some serious questions that way to decide when is it appropriate, when do you really need it. 521-8383. I am Dr. Bernie Portner, an MD, and your host today and every Saturday at this time. Please give me a call if you have any questions for me or any topics you wish for me to discuss. I'm here for the next hour to see how we can help you a little bit with some information. This is what doctors do best, is disseminate and teach information that can help you make certain health-related decisions. And those decisions have a large impact on your health and well-being. Not all of the human condition is simply a passive one, hoping that lightning doesn't fall from the sky and strike you dead for no fault of your own, or that you don't come down with some mysterious rare cancer, for example, through no fault of your own. While these things do happen, and it is part of our human condition, a great majority of the afflictions that we suffer as human beings are self-inflicted, based on our lifestyle, based on poor choices. So that's what we're here to talk about, not how to avoid the lightning. That's tough to do. Stay out of the storm, I guess. But how to avoid lung cancer, how to avoid backache, how to avoid heart attacks. These are avoidable, and people don't realize it. Poor guy had a heart attack. Well, poor guy was fat, didn't exercise, smoked cigarettes, and didn't control his diabetes, poor guy. So, not to sound without compassion, I have nothing but compassion for people who are ill. But why volunteer for it when facing us down the road is likely conditions that we have no control over? Why sign up and stand in line and volunteer for those conditions that we can avoid and should avoid? What do? What's the practical advice here? Well, a couple things. I'm not a wizard and can give you advice on how to live long. But here's a couple of suggestions. Being overweight is beyond a doubt a life shortener. There's no question about it. If you just look at insurance statistics, the heavier you are, the shorter you live. I recently had just to point this out, it comes to mind, I recently had a life insurance physical examination. And it wasn't a doctor who came to see me. It was a physician's assistant, a nurse of some kind, who asked all the right questions about smoking and exercise and family history. It's another something you can't do anything about. And then did the pertinent physical exam, took my blood pressure and took a cardiogram, an EKG to check my heart, and what else? He put a tape measure around my gut, my increasingly large girth. And I didn't have to ask him what's that for because I happen to know. But for those of you who don't know and you get a physical exam for a life insurance policy, they look at actually measure your weight, they measure your height, and then they measure your waist. And there's a formula that they plug those measurements into, and they can predict how risky you are as a policyholder for life insurance. If your gut is big relative to your height, it's going to cost you more to buy life insurance because it's going to cost them more. They're going to have to cash you out, so to speak, sooner. So simply by losing that gut, you can improve your life expectancy and your general health. Well, how do you get rid of that gut, short of liposuction? Well, The concept is easy. The doing is not easy, but the concept is easy. And most of you, I'm sure, know this, but it's worth pointing out. Like a bank account, the balance of your account, basically, when I say account, I mean let's just say your girth, your waist measurement. The balance, the size of that, whether it's 30 inches or 40 inches or 25 inches or 55 inches or 65 inches, the measurement around your waist has to do with, like a bank account, your income, how much you put into that account, and your outgo, how much you take out. You take out simply by breathing. Every time you breathe out, you lose weight. Why? Because your body is burning carbon and blowing out carbon dioxide. The carbon in the carbon dioxide has a weight. So does the oxygen. And as you lose that, you lose weight. To put weight on, you have to eat. When you exercise, you burn more carbon and you breathe out more carbon dioxide. So it's really quite simple. Increase the amount of calories that you burn by increasing your activities and or decrease your income, your intake, your caloric intake, your food. How the hell do you do that? How the heck do you do that, I should say? Well, what you do is you take a look at your behavior and say, I really like my potato chips. That's one thing I really, really like. Well, I speak from the heart here when I talk about potato chips. Like I told my mother, it's my favorite vegetable, potato chips. It's just fabulous. But that's something that you can do something about. You can decrease your intake of potato chips and do nothing else and lose weight, because that bag of potato chips that you're in the habit of eating several times a week accounts for a few pounds of fat, I would guess. Maybe a half an inch of your girth. I like to come home from work and flip on the TV and have some sweet snacks and munch on finger foods the rest of the evening. Well, if you just stop that, just the munching part, that too, and do nothing else, that too will take off maybe a half an inch off your girth. And if instead of flipping on the TV and sitting there, you decide to go for a walk for a mile or two, and a mile or two, for those that don't walk regularly, might sound like a far way to walk, but actually, a mile or two is just 15 to 30 minutes at a very slow rate. And doing that burns some calories, but also while you're doing that, you're not eating, so it's a double benefit. So this is a show about orthopedic medicine, but I'm talking a little bit about a more universal medicine, which is general health and fitness. Many of my patients decide to get healthy and fit, and they, like now it's getting to be time to start thinking about New Year's resolutions. They make it's too early. We'll wait another week or two. But it's time to get ready to think about these resolutions. We can start to think about getting ready to think about it. And in doing so, one gift for yourself and those around you is to make the resolution to get healthy. How can you do that? Well, join a spa. Start a new exercise program. Very good idea, but unfortunately, a lot of people that do that do it with too much vigor, too much enthusiasm, and break down. They get an injury, and that's very discouraging, because not only do they now have to stop their newly enthusiastic exercise program, but they're discouraged, and they come to my office and say, look, all I was trying to do was get healthy, and look what happened instead. Now I have pain, and I'm frustrated. I'm back in front of the TV eating all those snacks, and I've gained 5 pounds already. So, yes, if you don't exercise on a regular basis, the single best thing you can do for yourself for this New Year's resolution business is to decide to get active, but do so gradually. You don't want to go from not exercising to exercising 2 hours at a time in the gym as hard as possible, or joining an aerobics class and jumping on a mat up and down steps as much as possible for a long class 5 days a week. It won't work. Start now. Don't wait till January 1st. Start now. And if you have no problems walking, just go for a walk. It's so simple. And pick up the pace. And take a Walkman, portable radio with you so you can listen to my show while you're out there. 521-8383. No one's calling with questions because I'm babbling and rambling. 521-8383 will get you here to talk to me about anything you like about arm, leg, neck, or back problems. And we're talking a little bit about general health and fitness. And I'll be happy to go on and on about that all day because I'm passionate about it, is I guess the proper word. I like people. I like to see people, and I like to convince people that getting out and exercising and being active is the only way to go. And once in a while, people actually listen to me. And I can tell you this as a physician, I am never more gratified than I am when I tell somebody and convince somebody to give up a bad habit or begin a new good one, and they actually do it. I mean, I've been asking and preaching and begging people to stop smoking cigarettes since the 70s. That's 1970. And I can say maybe 12 people that I know of have actually listened to me, quit, and remain quit. And it's those dozen people that I feel I've done the most amount of good for in my whole career. And all those other thousands of people who I've helped get through backache and sciatica and bursitis and tendinitis and muscle strains and slip discs and torn meniscus and all kinds of orthopedic problems, yes, it's very gratifying. But if I can get people to stop smoking, and if I can get people to get into a healthier lifestyle and eat less and exercise more, those are real long-term victories. It's not a simple tendinitis, for goodness sake. Let's see. I guess I do have a caller here. Ed, thanks for calling. You're on the air.
Yeah, okay.
What's up?
I think what I did is I tore my meniscus because I did it in the other knee, and I've had surgery on the other knee. I was just wondering, I was limping, and now my calf hurts so much, and my ankle was kind of swollen. I was wondering, what did I do to my calf? Did I just maybe...
Let's go back a little bit before I try to help you sort this out without examining you. You say you think you tore your meniscus. Tell me what happened. What were you doing when you tore it?
Well, I was surfing.
You were surfing, and what? Was it your back foot or your front knee?
It was my back one.
So,
but I fell off, and I hit the rock, and I twisted it to the side, and I've had it on the other knee, so I'm sure it's torn. But
how long ago was this?
It's been about a month and a half.
A month and a half. And when you got out of the water, was your knee already swollen?
Yeah.
And have you seen anybody for this or had it?
Yeah. And they said, yes, it's torn. And I did it right after I tell the doctor right after I did it. He said, yes, it's torn, and you'll probably need surgery, but just see how long you can go and keep icing it and so forth.
And then when did the calf start to hurt? How many days or weeks later?
Well, yeah, like, I guess 3 weeks later, or 2 weeks later, and it just really, I thought I was doing some work, and both my calves hurt. I strained them, and then the one got better within a week, and the other one still hurts, and it's like just really.
How did you hurt both your calves 3 weeks
Well,
later?
I was working on a house, building and going up a ladder with a load and stuff, a lot of repetitive stuff. And then I was just sore. My muscles were sore the next day, and then my right one got better. But since I've been limping, I think I can notice I've kind of pulled the left one, and again, it's like swollen around the ankle. And
let me ask you about the swelling around the ankle. You said this came on also when a little bit, not when you hurt your knee falling off your surfboard, but when you injured both calves going up and down the ladder. The calf
right.
started to hurt. And how long afterwards did you notice the swelling about your ankle?
Well, the swelling came later than after I hurt the calf. It was
even
like,
later than that.
Yeah, like a week
and
after that.
Both ankles or just the
no,
bad one?
Just the one.
And when you look at your swollen ankle, does it look discolored as if you bruised it down by the bottom, towards the bottom of your foot? Does it look yellow or blue or bruised?
Well, it does kind of look yellow.
A little discolored?
A little bit, just a tinge, you know?
Okay, so usually, when, for example, you tear a calf muscle and it bleeds, so every time you tear a muscle, of course, it's going to bleed. Not for long, just a little bit until it clots, a few minutes.
Right.
That blood, with gravity helping, works its way down towards the ankle, and where the foot meets the ground, just above that, the skin is very close to the bone, and any blood that settles down there, coming even from the calf, will be seen, and it's seen in various colors, depending on how long it's been out of the bloodstream, because it goes through a degradation process. And we all know you get a bruise, it's first bright red and blue, and then it gets a brownish, and then it kind of turns a yellowish green, and then it disappears.
Oh, okay.
And it could be that you tore a muscle in your calf going up and down that stairs carrying heavy things, and the blood worked its way down to the ankle. Now, what's the connection between your knee injury and 3 weeks later your calf pain? Maybe nothing directly. Why is your one side, I don't know which side, are you goofy foot or regular foot on your surfboard?
Regular foot.
So it was your right knee. Why did your right calf hurt worse than your left? When you were walking up a ladder, it's probably an equal amount of weight on both sides, maybe.
Right.
So are you limping because of your knee?
Yeah.
So maybe the combination of the limp, it alters your gait. You're using your calf a little bit more.
That's exactly what I was thinking.
I'm just guessing there. But actually, I don't think that the knee injury is otherwise directly related to the calf injury. There are a couple conditions that come to mind where people have a swelling in the knee that there's an outpouching in the back of the knee called the Baker's cyst, and that's filled with the fluid of the knee swelling, and that can burst and work its way downward into the calf and cause calf pain and swelling. So sometimes people have that, but it's not usually a traumatic situation like with your knee. So how old are you?
60, almost 61.
Oh, you sound really young. You shortboard?
No, longboard.
Well, it's a little bit better. So, yeah, I don't know. As far as the meniscus goes, getting it fixed is a question not so much of how bad is the tear of your meniscus. It's a question of how many activities did you used to enjoy before you tear it that you now have trouble enjoying.
Right.
And that's the answer to that question. It helps you determine whether you need surgery or not. If you say, geez, I can't surf anymore, I can't jog anymore, I can't hike anymore, life is not fun anymore, then go ahead and have surgery. If you say, I'm quite content, I can still surf, it's not too bad, I don't like hiking anyway, you can leave it be. So that's one decision. As far as the calves go, that needs attention because I don't, over the phone I can't be sure, but it's my guess that it's a separate injury, and a treatment like friction massage and treatments locally to the calf are likely to do the trick.
Yeah, I was just, it came on it just didn't get better like the other one did, and I was thinking my worst fear was like, there's a blood clot there, maybe that's from the pain, but it gets better, and when I wake up in the morning, the swelling's gone way down.
Are you taking any aspirin or anything like that?
I just started it. I really don't like to do that, but I just started doing the aspirin, and that has really made a difference.
All right. The reason I asked about aspirin is not only is it a good pain reliever and anti-inflammatory, it's also an anticoagulant, so that the possibility of having a blood clot, which is possible anytime you have swollen tender calves, if you just take even one aspirin a day, it helps a great deal in preventing secondary complications to that clot, which you probably don't have. But I would, and how are you feeling about having your knee fixed now that I told you about the function? Is your life way worse now that your knee is broken?
Well, no, it's not that bad. That's what I was thinking, because when I had it on the other one, it was like extremely painful, and it locked, and it like, I guess the meniscus flipped over on itself.
Right. How long ago was this now?
Oh, that was like 10 years ago.
No, this more recent one.
Oh, just about a month and a half.
Yeah, so if things aren't too bad, see how it goes. I've seen plenty of people get back to their normal existence without having surgery.
So it kind of can heal itself? Because I'm taking glucosamine and
I don't know about healing, if that's the right word.
But just kind of...
But it can settle down and not give you much trouble. What it'll do from time to time is go out, and you'll have to click it and go back in. So you can decide over time if you want to get this fixed or not. It's not that big a deal to get it fixed. But if you can be happy without bothering, then just go surf instead of going to
wait and see.
Yeah.
All right. Well, thank you very much.
All right, Ed. Thanks for the call. I see I have another caller, but I think Roy is there. We'll wait on Roy and get this news in, and I'll be back in 90 seconds. Don't go away. You're listening to Dr. Bernie Portner on The Moving Body. Hope you're enjoying the show. If you have a problem with your arm, leg, neck, or back and are somewhat afraid or too shy to call, just call my office, 596-7300, and make an appointment to see one of us live and in person. Otherwise, call here at 521-8383, and we'll try to answer your questions. Thanks for listening, and let's get on with the show. All right, welcome back. Whoopsies. We have a Neighbor Island caller. Roy, go ahead. Roy, you called the 888 number, hopefully.
Yeah.
565-8383. That's toll-free for all of those on Neighbor Islands. Roy's calling from Kauai. What's the update, Roy? How's it going?
Oh, Dr. Bonner.
Yeah.
I just went to see the IME a couple weeks ago.
Yes?
Okay. He checked me out. He claims I have he says he thinks I have what do you call this word? Ankylosing spondylitis?
Ankylosing spondylitis?
Yeah. What's that? What does that mean?
Well, if it's true, it means we've been barking up the wrong tree for the last 2 years trying to make you better. Ankylosing spondylitis is a fairly rare disease that we think is hereditary. And it involves a stiffening of the joints of the back, mostly, and also the sacroiliac joints. And it's fairly easily diagnosed. The X-rays are very characteristic after a while. Blood tests are very revealing, and it's a disease of progressive stiffness and loss of the proper posture. You start to get stooped forward. But I would be very surprised, by the way, if that's what your problem is. It's possible, but it's not that debatable, because all you got to do to make the diagnosis is look at the X-ray, take a couple blood tests, listen to the history, and recheck the physical exam, and you have it or you don't. It's rarely controversial. It's rarely something that is maybe you got it, maybe you don't. So if that's what he thinks you have you ever had a blood test for it?
Yeah, I had blood test. I brought my X-rays too with me.
And after looking at the X-rays, You had X-rays. Now, did a radiologist? Of course, a radiologist read those X-rays. Yes, Roy.
Right.
So the radiologist who originally read the X-rays when you had it would have said this is ankylosing spondylitis. I mean, it looks like it if it is.
Well, he claims I have slight. I mean, I guess, I don't know if he meant.
The problem with that diagnosis, how did you injure yourself? Were you at work?
Yeah, right. It's a work.
I want you and all the listeners to know this. I'm about to say something that's kind of ugly about us as a society. A little bit ugliness here. Because our world is not all beautiful, but it's beautiful. But it's not all beautiful. There's some ugliness there. And in our world, one ugliness is this. There are doctors, they call themselves IME doctors, who are hired by insurance companies. And their job is to try to find something about the patient's presentation, about the patient's history, that will get the insurance company off the hook. If this guy, he's basically not independent. He's a doctor for the insurance company, not for you. Remember that. And if he is able to come up with a diagnosis that is not the responsibility of your employer gets off the hook. So if he says you have ankylosing spondylitis, then the employer and the employer's insurance company and the employer's insurance company's lawyers can tell you and your lawyers, hey, this is something he was born with. It's got nothing to do with anything that happened at work. He's got ankylosing spondylitis after all. Having slightly ankylosing spondylitis, it's like being slightly pregnant. It's not something that you can do slightly. It's an all or nothing kind of thing. So I would make sure that if you got ankylosing spondylitis, they prove it beyond any doubt, that your radiologist reads it on the X-ray, that your doctor gets special tests. There's a test called, write this down if you have a pencil, HLA, capital letters, HLA-B27. And
HLA-B27.
Don't ask me how I remember that, but that's a blood test that almost everybody with ankylosing spondylitis has, and those that don't have it don't have that test.
You know, when he said that, but I brought my X-ray and all that, and how he can determine by just looking at that and tell me that.
Yeah, well, there are some characteristic findings on X-ray of ankylosing spondylitis. Did your father have ankylosing spondylitis? Do you have any brothers? Do they have ankylosing spondylitis?
Nobody has
Does
that.
any of your father's brothers have ankylosing spondylitis? It's a disease that runs in the family.
Uh-huh.
So, unless there's irrefutable evidence that you have ankylosing spondylitis, I would fight that diagnosis tooth and nail. Because what it essentially does is it gets the IME doctor a bonus because he gets the insurance company off the hook. And they'll be sure to send him plenty more patients, because if he can prove that, then he can prove that your current back pain complaints have nothing to do with work and you're out in the cold, buddy.
But would that cause leg pain?
Not usually.
So that's my concern, I told him. When I went to see him, I just had my last epidural injection on the same week.
Yeah, did it help you?
Oh, yeah. So I told him, now I'm feeling better, so that's why it's kind of hard.
Yeah.
To diagnose.
All right, well, you make sure. What you want to do, if I were you, is I would spring for a consultation with a good rheumatologist. That's an arthritis doctor. They're the ones that know if you have ankylosing spondylitis or not. So that later on, if the insurance company ever claims that you have ankylosing spondylitis and therefore they're not responsible, you say, hey, look, that's what your doctor says, but I went to a real doctor, a rheumatologist, and he says there's no way I have it. So, you tell them to take that and roll it up.
Oh, so that's debatable then, yeah?
It's until it's proven, it's debatable. Once it's proven, it's not. But if the guy says maybe slight, and you don't have a positive blood test, and you don't have X-rays that look like it, then it ain't. Just don't let him. What's that?
Is there a cure for that?
No.
Do you have that?
No, there's no cure. There's just a treatment.
Oh, so you're going to live with that all your life already?
Yeah.
I have that.
Yeah, but if you have that, but I don't think you do. Relax. I don't think you do. I think it's just another cruel hoax by this insurance scam IME industry. I've seen plenty of, I know.
You know what, he told me to stand up, check my posture.
Yeah, nice.
And just looking like that, he says that word, spondylitis. That's what came to my mind.
Yeah, well, that's what he's paid to say, Roy. Anyway, good luck with this. I'll hear from you again, but you go to a rheumatologist and get another opinion about that. Don't worry about it. It's probably not true.
Well, I gotta talk to my doctor that sent me there, so I'm gonna see what.
Yeah, tell him what's up with this. If you have it, why did it take him 2 years to figure it out?
Right.
All right, Roy.
Okay,
right.
doctor. Thank you.
All right. Have a good day.
Yeah.
You're listening to Dr. Bernie Portner. The number here, 521-8383. Hope you're enjoying the show. Not too many callers today. It's some kind of holiday weekend or something. Not that many people going to work. Not that many people driving in their cars. Not that many people have questions about arm, leg, neck, or back pain, I guess, on a day like today. Too nice. But if you do have a question regarding the orthopedic musculoskeletal system, regarding injuries sustained in car accidents or work-related injuries, if you too have had a bad experience with an IME doctor, if you too have been injured playing sports, just give me a call right here, 521-8383. We'll use your question to help educate the rest of the listeners. Let's see. Earl, go ahead, Earl. You're on the air, and thanks for calling.
Hi, good morning, Doctor.
Good morning.
Hi. I have something that has started, it's been going on now for weeks, and it's becoming extremely bothersome.
You got to turn your radio off here, Earl, I think.
Oh, I'm sorry.
That's all right.
Okay, it's off. I noticed it started happening where I would be sleeping on one side, and I would wake up with a pain in my right buttocks. And I can press there, and of course it wakes me up, and it doesn't go away for quite a while. In fact, I'm sitting up now. I just got up, and it's still hurting. But I can reach down and touch this one spot in my right buttocks where the pain is coming from, and sometimes I take a massager and put it on that spot.
Let me interrupt you, Earl. Because what you just said might not be accurate, although it's your body and who knows better than you. But you said where the pain is coming from. What you meant to say is where the pain is felt.
Right.
Because where the pain is coming from may not be the same place as where the pain is felt. And many people have, for example, spinal problems that cause pain at night and hurt in the buttock or hurt down the leg. But, of course, you can do all kinds of treatments to the butt if you want to, if that's where it hurts. But if the source, the problem resides in the spine, nothing that you do in the butt will give you anything but maybe some temporary relief, maybe. But otherwise, it will not really, do the trick. You have to direct your treatment at the site of the source of the pain, not the site of the perception of the pain, if you understand me.
Right, because when I do use the massager on the spot on my buttocks, it doesn't do anything.
That's what I'm trying to tell you.
Yeah.
Do you have any pain down your leg as well?
No.
And do you have any pain in your back proper?
No.
Just the buttock. And is it only at night, or do you notice it during the day at all?
It's at night when I'm and what I have to do, like if I'm laying on my side and it starts to hurt, if I turn and lay on my back, it will subside after a while. But when I'm laying on my side, that's when it happens.
I see. And but you don't limp when you walk?
No.
Uh-huh. Have you had a history of low back pain?
Not really, no.
It's something that needs to be examined because buttock pain, which is what you have, buttock pain has three major possible origins, either the lumbar spine, the sacroiliac joint, or the hip joint. 99% of patients that have buttock pain and buttock pain only have a problem in at least one of those three areas. And you're not going to be an exception. That's what's going to be with you. But over the phone, from what you've said, I can't tell you which way it's probably going, but I can tell you this. The likelihood of that one spot that you push on that hurts, that when you massage doesn't make it any better, that's not likely the actual center of attention. You know what I mean? That's not likely where the action is. It could be, but then you would be 1 in 100.
Well, certainly, I've seen you before one time years ago.
Well, let's have a look at that.
I will do that. Now, one other question is something that I've been noticing recently is my left knee.
Is this the same side as your buttock? Where your butt hurts? Is that the left side?
No, right.
I see. So on the opposite side, your knee also gives you trouble.
Well, my knee, it's like it kind of wants to, from time to time, it kind of wants to give, and it feels like something is hanging. And it's like it kind of wants to give way, and then I'll just move my leg back and forth, and this happens only when I'm walking. But I was just wondering about that. About it kind of it feels like something is kind of catching, and it wants to give way, and then it'll go away.
That's a history that's most indicative, most suggestive of what we call internal derangement, usually a piece of cartilage or meniscus that's partially torn off the rest of the body of the cartilage or meniscus, and it flip-flops around, still attached, but able to, its stub is able to move around, and it can get in the way of the joint and float out of the way. So
can anything be done?
Yeah, plenty can be done, but first it has to be diagnosed. But that's not going to be probably a major problem either. I look forward to figuring this out, Earl.
Okay.
You'll
Thank
be
you very much, Doctor.
All right, thanks for the call. Len, go ahead. You're on the air, and thanks for calling.
Yeah, first time I ever called the show, and I got right on. How about that?
Not bad.
Yeah, hey, I woke up 3 days ago. I was not able to open up my right hand without help. It's like it's paralyzed or something. It hasn't seemed to be going away. I wasn't worried about it at first. I figured it was a pinched nerve or something, but it doesn't seem to be going away.
What, is it all the fingers or just one finger?
The 4 fingers and the thumb.
Are in a fifth?
I can't bring it back. You know, like straighten out your hand.
You can't straighten out the fingers?
I can close it, no problem. I play the drums. I still play the drums and everything, but I can't open up my hand without help.
And when you do it with help, is it against resistance or is it kind of easy?
Kind of resist. It's kind of like it wants to go closed.
When did this happen?
3 days ago when I woke up.
How old are you?
56.
Do you smoke?
Yes, I do.
Do you have a history of stroke?
No.
Do you have any problems with your vision?
It's just nearsighted.
Otherwise, so double vision or blurred vision?
Yeah, it's kind of blurry without my glasses.
No, that doesnn't count. And what about your leg on the same side? Does that seem?
I lost my right leg, ironically, 6 years ago, below the knee.
How'd you do that?
Car accident, being stupid on the Big Island.
And what about the leg, the rest of the leg that you still have by the hip? Does that seem strong?
I walk on it great. I mean, people can't even believe I lost it.
So your walking hasn't changed?
Not a bit, no.
Uh-huh.
I do have an injury on my shoulder. I fell the other day.
But this has been going on longer than that, than the fall.
Yeah, 3 days.
And you fell 3 days ago?
About 4 days ago.
And then a day later?
Just a little scab on my shoulder, though.
Yeah.
I get up all the time. I fall all the time in the storm.
Do you have any numbness or tingling in the hand?
Not tingling, no, but it's almost kind of like I can't really explain the feeling. It's kind of like a numbness, but it's not.
Where do you live?
Honolulu.
You gotta get this looked at right away.
I do.
Yeah. Because here's the possibilities. And I can't tell you what you have over the phone, so don't be frightened. I'm just giving you a list.
Yeah, well, you scare me. Yeah.
Menu. I don't want to scare you, but I don't want to also make light of it. You fell on your shoulder, and the next day you noticed there was weakness in your ability to straighten out your wrist and hand. And it could be that the fall injured nerves either in your shoulder or neck area.
That's what I assumed happened.
Well, that's one possibility. But with the tightness of the hand, that it's kind of in a grip position, and it's and you have to straighten it out against resistance.
It's not. I should restate that. It's not all the way closed. It's kind of like the normal, half cup position.
Right.
You normally have your hands.
Right.
It stays in that position, no problem. But it's just opening it up, straighten it out. I can't do that. No help.
Well, right. So I was asking you about your.
Just force myself.
Right. I was asking about cigarettes and stroke because stroke can do this, but I'm not saying you have that. The fact that you smoke makes it possible. If you didn't smoke, it's very unlikely.
Can you have a stroke and not lose your voice?
Yeah. You can have a stroke and have a tightness in your hand that you can't straighten it out and make it difficult to straighten it out. But that's a little bit down the list. I don't think that's high up on the list. Most likely, you've injured several nerves because one nerve won't affect the whole hand. The hand is serviced by several different nerves and nerve roots, and usually, if all the fingers are involved, it implies that there's more than one nerve involved. But this needs to be looked at.
Is it unusual to have no pain? I mean, I'm not in any pain whatsoever.
What about your shoulder?
No.
Yeah. Well, maybe it's unusual.
I slept on it wrong with what I did.
Maybe
so.
Sure.
Just.
Well, maybe it'll come back, but
that's what I was thinking. But it's been three or 4 days. I can't remember, 3 or 4 days.
And it's not changing at all.
Just a tiny bit.
In what way? For the better or worse?
For the better.
All right.
But this morning I was cleaning my pistol and I was having a hard time putting my rubber glove on my right hand.
So if this was my right hand, I would take it with the rest of me to a doctor.
Yeah, I hear you. Yeah.
A neurologist or a physiatrist like myself or a orthopedist or even an emergency room doctor and have it looked at right away because you don't want to lose the use of that hand.
Oh, certainly not.
So don't fool around with that. Have it seen, if not today, Saturday.
I'm VA, so I'll probably go in there Monday morning, I guess.
Well, you could go to Tripler ER.
Yeah, that's true.
And tell them I'm a little concerned about this.
I'm 100%, so.
And go ahead and they'll look at you and get you to the right guy. And if you need somebody this weekend, they'll arrange it. If it can wait till Monday, they'll tell you. But I don't think you got anything better to do today.
No, you're right.
Go ahead.
Okay, thank you, doctor.
All right, Len. Thanks for the call. Good luck, buddy.
Thank you.
Let's see. Time for one last call, maybe. John, go ahead. You're on the air, and thanks for calling.
Hello, Kaneohe, doctor.
Yes, sir. What's up?
I have a pulled bicep muscle. I'm not sure if it's a major pull or a minor tear.
Well, when you make a muscle, does it look normal or does it look like Popeye?
It looks more or less normal, except right above the inside joint.
Yes.
Below, on the bottom of the bicep, there's a little tiny bulge or pop. I don't know if that's
You may have torn the muscle or tendon partially. When did this happen?
This happened 8 days ago.
And is it very painful or not bad?
It's if I leave it alone,
yeah,
it's not bad.
If you use it though, if you have to lift something with it,
it's uncomfortable.
Yeah.
Well,
this is if it was completely torn, then it would look like Popeye when you made a muscle because there would be a big bulge where it tore. If that's not happening, then it's more likely a partial tear or just a strain, and it will get better. Physical therapy can help, called friction massage. Best thing to do is to have it examined, make sure the diagnosis is accurate, and then, if so, to have some physical therapy called friction massage. Ice is also useful, although 8 days later it's not as important. All right, John?
Okay. Would that be an orthopedic surgeon that I would see?
Yeah, that would be a good start. That'd be
good.
Thank
you very much.
All righty.
Thank you, Dr. Mahal.
Aloha. Orthopedic surgeon or orthopedic non-surgeon like myself, because if it's not ripped completely, it's probably not a surgical problem. Marisol, I guess we got time for a very quick question. I got 1 minute, Marisol. You're on the air.
All right. Yes, doctor. I just want to ask because I have a problem with my hands when I do painting and when I do the brushing or stick something on my pocket or anything to do with my left hand, I feel a numbness on my hand, and I could hardly close my hand.
How long have you had this, Marisol?
Like on and off for like 3 years. But
How do you feel in the middle of the night? Does it ever wake you up?
Not really.
No,
it's just when I'm working something with my hand.
Yeah. Have you talked to your doctor about this?
Not really. It just concerned me the last couple of weeks because I do a lot of painting and brushing and moving my fingers and my wrists.
I would have it looked at because it might be something that can be easily diagnosed and then treated. Why live with it? And then also it might progress. So have it looked at. I got to go. Excuse me. I'm sorry to cut you off so fast, Marisol.
All right. Thank you very much.
You're welcome. Bye, everybody. Have a good weekend, and we'll see you next week.
Thank you for listening to The Moving Body. Hope you enjoyed the show. Remember, if you're having problems with your arms, leg, neck, or back and would like to get an appointment over at the office on Pecoy Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, X-ray, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray's normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendonitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time on this station, 7 o'clock on KHVH. Go out there and exercise this weekend. It's the single most important thing you can do for your health and body. Health cannot be bought off the shelf. Special nutritional supplements is not what it's going to take to improve your health. It's going to take a lifestyle change. It's going to take for you to put on some good walking shoes and get out there and take a walk every day. We'll see you, everybody. Have a good, healthy weekend, and tune in next week. Bye-bye.